Oh, my name is Stephanie, and I will be caring for you today. Can you tell me what brought you in?
I have real bad heartburn.
When did these heartburns occur?
Starting like this morning.
Okay. Have you ever had heartburns before?
Yeah,
Can you tell me if you had any present illnesses?
no,
No present illnesses. Do you have a past medical history?
no, I'm not just having acid reflux.
You have acid reflux. You were diagnosed with acid reflux. Do you recall the year?
2007.
Okay. Do you have a family history such as mom and dad?
Happened what?
Any type of medical history?
Yeah, my mom, she had high blood pressure. She I think high cholesterol. She had history of having migraine headaches.
Okay. How about your father?
Um, I think he had high blood pressure as well. That's all I know about.
Okay. Grandparents?
Um, my grandmother, which is my mom's mother, she had she had to get a heart stent. Well, she had like open heart surgery.
Okay. And your grandfather?
My grandfather, he died of cancer, prostate cancer. He also had congestive heart failure
What year did your grandfather pass away?
in 2009.
Okay. So, do you have a social life?
I'm sorry, 2011.
2011. Okay. I'm sorry to hear that. Do you have a social life? Do you have any friends that you go out with or
No,
hang with? Are you married?
yeah,
How long?
14 years.
Okay. Do you have any children?
Yes, I have two boys,
Two boys. How old are they?
13 and 18.
Okay. So, do you have any issues with your weight? Any weight gain or weight loss without trying?
No,
Okay. Do you have a diet that you follow?
no,
No diet. So how is your appetite? Is it poor? Is it okay?
yeah, it's okay. I at least eat 2 meals a day.
Two.
Like
Okay.
snack throughout the day.
Okay. Okay. So what type of diet do you have? Do you
Uh,
eat out a lot or
I eat out more than I should.
okay? So have you had any problems with your skin? Any rashes, lesions,
No,
blisters?
no.
Okay. Any problems with headaches or any type of head injury, dizziness, lightheadedness?
I have been getting headaches. Lately, I went and seen a neurologist, and he put me on some medicine that's kind of stopped me from having a headache. Also, had an MRI. Uh, Waiting on the results to come back from that.
Okay, so when did you see the neurologist?
A couple weeks ago.
And did you have the MRI?
2 days ago.
Okay. Any problems with your vision?
No,
Any blurry vision? Any type of double vision? Do you wear glasses or contacts?
no,
Any problems with your hearing?
no.
Any sensitivity?
Well, I did. I'm an engineer in the Navy, so we did our hearing conservation program, which we had to get tested once a year. They had to reset my baseline because I failed the last two hearing exams.
Okay. So, are there any interventions that they're going to do as far as your hearing is concerned?
Now, once they set the baseline, it's just they reset my baseline, so they just text me. They'll start basically start me over.
Okay, no discharge or anything like that from the ear.
No,
Any problems with your nose or sinuses?
no,
No nosebleed during the night or anything like that? Any issues with swallowing or chewing?
no,
Any issues with your throat?
no,
No irritation there? Any problems with your neck, like neck stiffness or any lumps that you've noted?
no,
Any problems in the chest area as far as like with your nipple area? No discharge, no lumps noted.
no,
Any problems with coughing or bringing up any type of discolored sputum?
no,
Have you ever had asthma or been told that you had asthma?
no,
No other respiratory issues or concerns? Any problems with your heart? Any racing of the heart or you feel like um, Your heart is beating too fast when you're walking, short of breath.
No.
Okay. How about your stomach and your abdomen? When was your last bowel movement?
This morning.
How was it? Was it soft, loose, watery?
It was soft.
Was it formed?
Yeah.
Any blood?
No.
Have you ever had any issues with hemorrhoids or rectal bleeding?
No.
Um, have you ever had any peripheral vascular issues such as varicose veins or any swelling or redness or tenderness to the legs?
No. I got varicose vein in my left thigh and calf muscle area.
Have you ever went to the doctor about it for any reason?
Yeah.
Can you tell me, or do you mind sharing with me the outcome of that?
They told me to get these compression stockings and sleep with them wearing.
Do you wear those?
No.
No?
No.
Okay. All right. Any problems with urination?
No.
Urinating a lot? Any burning? Anything like that? Any issues with your genital area, like sores? Have you ever had an STD?
No.
Okay. Any issues with your muscular system, such as anything that would keep you from doing your normal routine, like weakness or limiting you to balance yourself or anything like that?
No.
Any depression?
No.
Have you ever had any thoughts of suicide?
No.
Do you receive any counseling for any particular reason?
No.
Okay. Any changes in your neural status, such as dizziness, or you feel faint, or anything like that?
No.
Any tremors?
No.
Okay. Have you ever had a blood transfusion?
No.
Any internal bleeding that you were aware of?
No.
Have you ever had excessive sweating for no apparent reason?
No.
Any heat or cold intolerance?
No.
Okay. You said you had never had any problems with your musculoskeletal other than no problems with anything, your leg or anything except the varicose veins.
I had a bone from Achilles. I got an MRI done on that, and they've been giving me a problem. They don't. They gave me some Movit. They put me on some Movit, trying to take every day. Try to kind of
Do you recall how often and the milligrams to the Mobic?
I think 10 milligrams I'm supposed to take every day.
Once daily?
Yeah.
Can you tell me your medications that you're taking other than the Mobic? What else are you taking?
Nexium
How often?
once a day.
What's the milligrams on that?
40 milligrams.
Are you taking anything for pain at all?
No.
You mentioned that you went to see a neurologist in the MRI with the headaches. Was that you mentioned a medication for that? Do you recall that medication?
I haven't went and picked it up yet, but I don't remember the name of it.
What do you take normally if you get a headache?
Just Cedrins, Motrin,
Ex-
Tylenol.
Okay. All right. This concludes our health history. Thank you. Have a nice day.